Does dairy harm fertility? The truth about milk, hormones, and ovarian health. What if one of the most common foods in the world was silently affecting fertility? For years, milk has been marketed as a symbol of health, strong bones, protein, calcium, childhood nutrition, but recently social media, fertility influencers, and even some doctors have started warning women, stop eating dairy if you want healthy ovaries. Some claim milk causes hormonal imbalances, others say it worsens fertility, acne, PCOS, inflammation, or endometriosis. So let's begin. For the first, before talking about dairy, we need to understand how the ovaries actually work. The ovaries are not just reproductive organs, they are endocrine organs. And that means they produce hormones every month. The ovaries perform an incredibly complex biological process. Follicles grow, egg mature, hormones rise and fall, ovulation occurs, progesterone increases, the uterine lining changes. This process depends on balance, and the ovaries are extremely sensitive to insulin, inflammation, stress hormones, nutrient deficiencies, body fat, sleep, toxins, and diet. If these symptoms become dysregulated, ovulation can suffer. This can lead to irregular cycles, poor egg quality, anovulation, infertility, PCOS, hormonal acne, low progesterone, miscarriages. So the real question is not, is dairy good or bad? The real question is, how does dairy interact with the hormonal systems that control ovarian function? What is inside dairy? Milk is biologically designed to grow a baby mammal rapidly. That means it naturally contains protein, fats, sugars, growth factors, hormones, bioactive peptides. So the most discussed compounds are IGF-1, insulin-like growth factor 1. IGF-1 stimulates growth and cell activity. Some studies shows dairy consumption may increase circulating IGF-1 levels. Higher IGF-1 can influence insulin signaling, androgen production, ovarian hormone balance. If women with PCOS, this may become problematic because PCOS already involves excessive insulin signaling. Second, estrogen compounds. Modern dairy often comes from pregnant cows. During pregnancy, estrogen levels in cows increase. Tiny amounts of estrogen metabolites can remain in milk products. So, scientists are still debating whether these amounts significantly affect humans, but researchers are studying possible links between dairy hormones and acne, estrogen dominance, menstrual irregularities, endometriosis. The evidence is mixed. Very important, not definitive. Third one, whey and casein proteins. These proteins are highly insulinogenic, meaning they stimulate insulin release even without high sugar. This matters because chronic high insulin can affect ovarian function, especially in insulin-resistant women. Fourth one, lactose. Lactose is milk sugar. Some women digest it poorly. Undigested lactose can contribute to bloating, inflammation, gut irritation, microbiome imbalances, and gut health strongly affects estrogen metabolism. For Chapter 3, the science of dairy and infertility. Now let's talk about the actual evidence. One of the most famous studies came from the Harvard Nurses' Health Study. Researchers found something surprising. Women consuming higher amounts of low-fat dairy had a significantly higher risk of ovulatory infertility. But women consuming moderate amounts of full-fat dairy had a lower risk. This shocked many scientists. Why would low-fat dairy potentially worsen fertility? There are several theories. Theory 1. Hormonal alteration during fat removal. When fat is removed from milk, fat-soluble vitamins decrease. Hormonal balance of the product changes. Sugar concentration may properly increase. Some low-fat dairy products also contain added sugars, which can worsen insulin resistance. Theory 2. Insulin spikes. Low-fat dairy may create stronger insulin responses. High insulin affects the ovaries directly, especially in women with PCOS, metabolic syndrome, abdominal obesity. This can disrupt ovulation. Theory 3. Inflammation. Highly processed dairy products may contribute to inflammation in sensitive individuals. Chronic inflammation can damage egg quality, ovulation signaling, endometrial receptivity. But there is the critical point. The evidence does not show that all dairy causes infertility. Many women tolerate dairy perfectly well. Some populations consuming fermented dairy regularly there have excellent outcomes. So scientists does not support the cutting of all dairies. Chapter 4: Dairy and PCOS. Let's talk especially about PCOS. Polycystic ovarian syndrome is one of the most common causes of infertility, and insulin resistance plays a central role. When insulin stays chronically elevated, ovaries produce more androgens, ovulation becomes irregular, inflammation increases, acne worsens, egg maturation suffers. Some women with PCOS notice major improvements with cutting off dairy. Some dairies like ice cream or flavored dairies, but they have better cycles after that. However, other women with PCOS tolerate fermented dairy very well. For example, Greek yogurt, kefir, cultured yogurt, because these foods may support the gut microbiome and provide protein. This is why personalized nutrition matters. For Chapter 5, Endometriosis and Inflammation. Women with endometriosis often ask whether dairy worsens in symptoms. Research is complicated. Some studies suggest high-fat dairy may actually reduce endometriosis risk. Others suggest certain dairy proteins may worsen inflammation in sensitive women. Again, there is no universal answer, but many clinicians use elimination trials, meaning a woman removes dairy for 4 to 8 weeks and tracks pain, bloating, digestion, skin, energy, menstrual symptoms, and if symptoms improve significantly, dairy sensitivity may exist. Best types of dairy for hormone health. If a woman tolerates dairy well, these are generally considered the best options. Plain Greek yogurt benefits high protein, probiotics, lower lactose, supports satiety. Recommended amount is 150 to 250 grams per day. Kefir, excellent for gut microbiome diversity. It's good for digestion, inflammation reduction, immune balance. 1 cup daily is good. Small amounts of aged cheese, Parmesan, Feta, Gouda, it was for just 30 to 40 grams per day. It may be good and moderated. Organic, full-fat, unsweetened dairy. Some experts prefer minimally processed dairy over highly processed low-fat products, especially for women without insulin resistance. Who may benefit from reducing dairy? Some women may benefit from reducing or temporarily eliminating dairy if they experience severe acne, PCOS with insulin resistance, chronic bloating, digestive distress, inflammatory, and suspected to endometriosis. But dairy elimination should be done carefully, because removing dairy without replacement can cause deficiencies in calcium, iodine, protein, vitamin B12. Best dairy alternatives. Let's talk about that. If avoiding dairy, here are evidence-based alternatives. First, unsweetened soy milk. Its closest protein content to milk contains isoflavones. Contrary to internet methods, it is good for fertility if you use it moderate. Some studies suggest it supports women fertility and health. 1 to 2 cups per day is good. Almond milk, it's have a low calorie but very low protein, good for coffee, smoothies, not a protein replacement. And a third one, pea protein milk, higher protein, often fortified, good option for fertility nutrition. Coconut yogurt is maybe good, can work for women avoiding dairy, but many brands are low protein and high fat. Always check the labels. And what actually damages ovarian health? This is important. Many women become terrified of single foods, but ovarian health is usually affected more by chronic stress, poor sleep, smoking, ultra-processed diets, insulin resistance, obesity, nutrient deficiencies, sedentary lifestyle, environmental toxins, and not simply just one cup of milk. The body is a system, and fertility reflects the entire metabolic environment. The most scientific conclusion. So, does dairy weaken the ovaries? At the end, scientists says, not universally. For some women, dairy may worsen inflammation, acne, insulin resistance, or hormonal symptoms, but for others, fermented or moderate dairy may fit perfectly into a healthy fertility supportive diet. The strongest evidence today suggests individualized nutrition matters most. Processed sugary dairy is more problematic. Gut health and insulin sensitivity are critical. Total dairy dietary pattern is more important. Instead of fearing of dairy, focus on sleep, exercise, blood sugar, nutrients, and always remember your hormones are not controlled by just one ingredient alone. They influenced by entire lifestyle. If you enjoyed this deep dive into women's hormones and fertility, subscribe to the channel and comments below.